Well, I'm now joined by Mohammed Munir, who is a molecular virologist at Lancaster University here in the UK. Mohammed, thanks so much for joining us. What's your reaction to the Prime Minister's plan? Is it good they have a plan B?
Well, if we look on to the overall occupancy in the healthcare sector, we have around 8,000 people in our hospital, which account only for 7% of the total capacity, which means there is still quite a lot of space that can accommodate any burden that will come across during the winter. And this winter is going to be a little bit different because we have a certain freedom of movements which bring other respiratory infection, including influenza, respiratory syncytial, and rhinoviruses. So the plan that has been proposed now is more pharmaceutical interventions, emphasizing onto the vaccination. But if the number of cases would increase, then we'll roll out to non-pharmaceutical intervention, which certainly nobody wants to see that, but winter can bring any surprises.
Yeah, I mean, why is winter so bad for flu? Is it because we're all indoors?
Well, for the last 2 years, as you know, we haven't seen much of the flu, primarily because of the control measures that have been put in place for SARS-2 has been working for influenza. But this year is a little different because there is a certain level of travel, there's a certain level of movement within the countries, and that means that the influenza can come in. And influenza spread the same way as the SARS-2. So if the SARS-2 wouldn't be under control because of pharmaceutical intervention, that means the influenza will also not be under control. And I think the more important is to have the flu jab this year, more important than ever before, so that we will have a better handle on to the respiratory infections while having tackling the other burden of the backlog of the patient.
So get the flu jab, but what about the coronavirus boosters being offered? What's your opinion on that when much of Africa still remains largely unvaccinated?
Well, absolutely. This is a very important question, and I think this is a testimony for most of the developed nations to think about booster jabs. Although we know that the overall immunity is reducing from 4 to 6 months, that means certainly boosters are required. But the question lies that boosters are there to protect the people from new variants, from new infections, and those new infections will keep coming if the rest of the world is not vaccinated. So if I would be the deciding body, I think the first priority should be given to the frontline health workers and vulnerable communities out there in the developing world who are not having enough vaccine than thinking about the boosters, because ultimately we are all in together. Until it is not controlled everywhere, it's not going to be controlled in a small island like UK.
Okay, Mohammed Munir, great to hear your thoughts. Thanks so much.